back to Focus Atlanta. Again, I am your host, Keisha Lance-Lynn. Thank you so much for tuning in. We're going to talk a little bit about your health and your vitamin D level. I'm here with Dr. Ken Redcross. Dr. Redcross, thank you so much for coming back on Focus Atlanta. It's a pleasure to see you.
Oh, it's even better to be here. I wish it could be in person, but that's all right. We'll try this again in some months or years to come.
That's right. That's right. This time, though, you have come to, continually you come on to give us some education. And I'm really excited about this. You read articles about which vitamins you need to be taking for which things help your immunity system and what helps what. And all of us are kind of missing out on the vitamin D. Tell me a little bit about the importance of vitamin D for us.
Okay, so thank you for that. So Keisha, for those who may not know, so I'm a practicing internal medicine physician. So I'm Western trained, Keisha. But everyone, I've kind of seen the light, and I realize that there's alternative ways of healing that we need to be really incorporating, especially into our community. Now, we all know the vitamin D story. We all know it's for the bones and that sort of thing, but that's the old story on vitamin D, Keisha, because now, to your point, we're learning about vitamin D's importance for our immune system. And so there's a lot of interesting things that we've learned about vitamin D recently that really allows us all to kind of start listening and incorporating it more into our diet.
And I love that because I think that we take it for granted because we feel like if we go outside and get a little sunshine, okay, we're fine. Yeah. But no, we should be looking for it in the things that we eat. We should be looking for it in different ways. Tell me a little bit more.
So I should actually retract that a little bit when I said a little bit of vitamin D in our diet. What I meant by that, everyone, was really thinking about it as supplementation into our diet. And let me explain why. So vitamin D is something, Keisha, that's not particularly rampant in our diet. In other words, where everyone will think about milk, but milk is fortified with vitamin D, meaning that it's added fatty fish livers such as sardines and that sort of things. Not everyone's favorite. But loaded with vitamin D as well, but it's something that's not really in our diets. Therefore, we have to think about supplementing, especially when you have brown skin, like our beautiful skin. As beautiful as it is, it blocks out the rays of the sun. And so therefore, for us and Latinos, it's the same in that because of our melanin in our skin, since it blocks out the rays of the sun, we tend to be deficient. And that's African Americans about 80% and Latinos a little under 70%. So why is that important, Keisha? Because when you look at the 3 or 4 disease states that are associated with the coronavirus, you look at the fact that those who are diabetics, obese, heart disease, lung disease, all of those states have been shown in studies to also be low in vitamin D. And marry that with the fact that African Americans are also low in vitamin D, Keisha, it's a story that we're starting to learn more and more about, especially in our community, in the Latino community, why vitamin D is so important. So it's an exciting time when you think about it.
So if we can get the supplements that we need, what should we be looking for? Because, that's the other thing. We get into that aisle in the grocery store or the health food store, and we don't even really know what we're looking for, Dr. Redcross. Right. I'm just going to tell you the truth.
Right. The truth will set you free. It's okay. It's okay. So I'll tell you, everyone. So look, the important thing is this. One of the big things and to be on the show today is to make sure that I want each and every one out there, and even if you're not African-American or Latino, I want you to know your levels. I want you to, as I've been saying lately, get on my level. And what does that mean? I want your vitamin D level to be between 40 and 60, but you have to get it checked. There's 2 ways to do it. You could try to get to your doctor's office, which I know has been a big challenge for everyone, especially with COVID. But the way that I talk to a lot of patients about is really going on a website called thepowerofd.org. Now, I mentioned thepowerofd.org for a couple of reasons, everyone. If you go to there, you can order an at-home test kit. So a lot of us are already familiar with doing a finger stick if you're diabetic or our grandmas and that sort of thing. Well, this is a finger stick test as well. So if you go to thepowerofd.org, not only can you order a test kit, but you can also get your results, put the results into their calculator, and it'll tell you how much vitamin D you should be taking as well. Now, if someone puts my feet to the fire and says, well, Dr. Redcross, I was in the barbershop yesterday, kind of educating everybody, socially distanced with masks, but I was letting them know that that sweet spot tends to be between 2,000 and 5,000. And quite honestly, 5,000 is a good level to be at when you're thinking about getting a good amount of vitamin D3 when you're looking over the counter to see what you can do to really keep your health up and optimal.
Thank you so much for all that. You always bring us such good information when you come on Focus Atlanta. That's why I can't wait till the world opens up and you can come back in studio.
Oh, I can't wait.
Sit down again, talk about some more stuff. Thank you for your time.
Oh, thank you so much for having me. And everyone, please reach out and say hello. I love answering questions and meeting new people. And you could do that whether it be at any of my social media handles, which are all at drkenredcross.com or at Dr. Ken Redcross.
All right, guys, visit Dr. Ken Redcross on social media and go to the website to find out what your vitamin D levels are. You want to find out what that might be, to find out what you might need. So many of us take these things for granted, right? Well, we've learned that there's no more time for taking our health for granted. Please take the opportunity to go to the website, learn a little bit more, and stay tuned for more Focus Atlanta. We'll be right back.